I tweeted something a couple of weeks ago about therapy, and I expressed my view that I've said several times publicly, that I think therapy is very often a waste of time. It's very often something that does more harm than it does good, and we'll expand on that in a moment. That turned into a conversation about mental illness and things like depression and anxiety, something I've also talked about quite a bit, and whether those things are really a disease or whether they've been miscategorized. And I think that we have made sort of a category error with them. That made people very upset. And that's when it was suggested that you and I should talk. And I think people are hoping that you'll set me straight on some of this. So I'm hoping that we could kind of start with the second thing, which is mental illness. And then I think that will lead more naturally into the conversation about therapy and what it is and what its purpose is. So my view, just to start things, is that it seems to me we've made a major mistake in treating things like depression as a disease, as if having them is like having diabetes or malaria or something, treating it as a totally physical phenomenon. And from that category error, a lot of negative consequences have followed. But what do you say to that?
Well, I would say that within the broad and vague category of depression, there are many separate entities lurking and hiding, and that conflating them is problematic with regard to understanding and also with regard to treatment. And so depression per se is a secondary category. It's a secondary manifestation of proclivity to negative emotion. That's the broadest possible conceptualization. And that manifests itself in the personality structure as trait neuroticism. All of the negative emotions clump together, which means that if you're more likely to experience one, you're more likely to experience all of them. So you could think that there's a general emotional arousal capacity that typifies emotions, and it branches into two major subcategories, positive and negative emotion. And those are quite separate neurologically and psychopharmacologically, functionally, although they are to some degree mutually inhibitory. So there are chemicals that increase positive emotion and there are chemicals that decrease negative emotion. The chemicals that decrease negative emotion can be subdivided into chemicals that decrease anxiety per se, that's benzodiazepines, barbiturates, and alcohol, and medications that decrease pain. And pain is frustration, disappointment, grief, shame, and physical pain. So that's the negative emotion side, is where you have trait neuroticism, and then that can be subdivided, that can become pathological. And by pathological, what is meant is something like either unbearable or interfering with functions associated with most basically survival and reproduction, right? And that's a judgment call when levels of negative emotion get so high that they now take on clinical significance. The way that well-trained clinicians determine that is that levels of negative emotion have risen to the point where, as I said, either the person finds it subjectively unbearable or there's evidence that important domains of broad function have been compromised. That would be, so for example, if I was trying to determine if you abused alcohol, I would find out, first of all, how much you consume, but then I would find out, is that causing you trouble with the police? Is it causing you trouble with yourself in terms of guilt and shame and regret? Is it causing trouble with your family? Is it interfering with your employment? Right? Is it starting to take over your life? And you make the same kind of diagnostic judgment when you're evaluating someone who's suffering from an excess, let's say, of anxiety or an excess of pain, which would be more a depression-like phenomenon. Now, and so you have to do a very careful diagnosis to find out to what degree that's occurring, to what degree it can be attributed, let's say, to anxiety or to depression, how long-standing it is, and then there's the necessity for a detailed causal analysis. You made mention of the mistake of categorizing depression, for example, which is a pain-like phenomenon, as an illness. And I would say, well, sometimes it is a consequence of a physical illness, and sometimes it's more psychological or functional. And you have to be very careful from a diagnostic perspective that you get that right. So I'll give you an example. I just talked to a neuropsychiatrist at McLean's Hospital in Boston named Chris Palmer, and he's very much convinced that a lot of endogenous depression, and so that's depression that doesn't seem to have a immediate cause in loss or other catastrophe, is a metabolic disorder, and he's trying desperately at the moment to treat it with diet. So there's some forms of depression that are clearly illness related. Like we've known for a long time that you're much more likely to have signs of immunological dysfunction if you're depressed, for example. So when I diagnosed my clients, the first thing I would try to figure out was, well, are you just ill? I don't mean just as if that's nothing. It's not nothing. But if the depression is a secondary consequence of some physiological disorder, that has to be, well, that's the first place you'd start, hopefully. See if the person's just ill. And there's lots of forms of depression that seem to have that more physical illness-like manifestation. So seasonal affective disorder is a good example, because people who have seasonal affective disorder are reliably much more depressed at the darkest times of the year. And that seems to be a circadian rhythm disorder. So, sorry, that's a long-winded answer, but it's necessary. There's the broad category of negative emotion. There's the narrow category of depression. Within depression, there are multiple entities, and they have some commonality, and the commonality would be pain-like suffering, but the causal roots can be manifold and virtually unrelated. Yeah, so that might help clear it up.
So if depression is a consequence of a physical illness, then does that mean that the depression itself is an illness, or is it just a manifestation of an illness?
Well, see, there's a problem with the question, because it's not much clearer what an illness is than it is clear whether or not depression is an illness, right? Because you can think of illness in a relatively straightforward manner as something caused by a pathogen, like a virus or a bacteria, but there's many things that we would consider illnesses that aren't obviously caused by a pathogen. And so the notion of illness is in itself the kind of mystery that you're also facing when you are trying to wrestle with the question of what constitutes depression. You can define illness as deviation from normality. Sometimes that's a useful conceptualization. You can define illness as deviation from ideal, which is quite a bit different than deviation from normality. You can define illness in terms of function. So if you're sufficiently led astray by a given circumstance or trait, so that, as I mentioned earlier, multiple important areas of your life are compromised, then that can be thrown into the category of illness. Both illness and health, let's say, if they're opposites, they're very, very ill-defined and global concepts. This is partly why the idea of healthcare in some ways is also utterly preposterous, because, well, what isn't relevant to health? If you have a category that's so broad that it contains everything, it's not that useful as a category. And health is a category that's essentially that broad. Health doesn't mean much different than ideal, for example. So is depression an illness? Well, the problem with those binary questions is that by asking them, you assume that one of those concepts is more well-defined than the other. And in this case, it's just not.
Would it be, do you think it'd be fair? I haven't really thought much about this, but the actual definition of what an illness is interesting. When you pointed out that it takes some thinking to get to that. But would it be too simple to say that illness is a physical malfunction of some kind?
Well, it's sometimes it's too simple, because you can be you can become physically ill for reasons that are essentially psychological. Now, it depends on where you draw the line between psychological and physical, but we'll just use common language approach. I've had clients who, and this is specific to more, let's say, cognitive approaches to depression. I've had clients who were cast into misery as a consequence of thoughts and behaviors that weren't sufficiently functional. So, for example, you can find yourself isolated, alone, angry, bitter, resentful, stressed, with high blood pressure and panic attacks because you have no friends, and you can find yourself in a situation where you have no friends because you have no social skills. And you have no social skills, let's say, because you weren't socialized well, and you lack a lot of the micro routines that make you socially acceptable. Now, that's a complex pathway to pathology, but you can understand that a behavioral approach to that, or even a cognitive approach, might be the most appropriate. There's lots of people who are miserable because they're isolated. That's very common, and they're miserable enough so that it's not only making them suffer subjectively, but the stress that's associated with that destroys them physiologically. If you are stressed beyond a certain level, your body starts to devour its future resources to manage the present. That's what a stress response does in some ways. It ratchets up your metabolic rate even, so that you can focus more attention on the present to solve the crisis that surround you. But the cost of that is that you're burning resources that you might optimally want to conserve for the future. And if you're doing that for a few minutes or even hours because you have to address a crisis, well, fair enough. You'll go to sleep, you'll eat, you'll go to sleep, you'll recover. But if you're like that chronically, then it starts to physically take you apart. It accelerates your aging. That's a good way of thinking about it. And so a stressful job can do that. Would you say, well, having a stressful job an illness? Well, no, but it certainly can contribute to having all sorts of illnesses. That's absolutely crystal clear. And so now, you're concerned, I think, more, and probably rightly so, with fuzzy thinking around such issues. And you should be concerned about that, because when you go see a professional who will undertake an appropriate diagnosis, you want someone who's sharp and who uses very careful definitions, because if they aren't capable of making such differentiated diagnosis, they won't identify the cause of your problem, and in consequence, they won't treat you effectively. It would often take me months to diagnose someone who came to me as a client. Now, there's a tremendous amount of pressure on physicians and psychologists, psychiatrists for that matter, to diagnose in the first 5 minutes of their encounter. And even patients/clients themselves might want that, because no one likes to live in a mystery. But I'll tell you, man, getting the problem right is 90% of the solution. In psychology as well as in politics, you might say. You want to make sure that you're barking up the right tree. And that's very tricky in a situation where the person's presenting symptoms are in the constellation of depressive ideas and emotions. Technically, depression is a pain-like disorder, by the way, as opposed to anxiety. So anxiety, especially excess anxiety, is a response to threat. Pain is a response to punishment and damage. So anxiety is a more abstracted form of negative emotion. If you're depressed, you're more likely to be anxious, and vice versa, because all negative emotions overlap. But the treatments for those two things they're also quite different.
Thanks for checking out this video. If you'd like to listen to my full podcast on the go, you can check out The Matt Walsh Show on Apple Podcasts, Spotify, or wherever you get your podcasts.